All right, so let me go back to you, Donna, on that. Every parent to have access to it. But, if you're talking about schools, we both know that sometimes it's harder to engage the harder to reach families, or those the schools really want to engage may not be interested. How can schools more actively engage parents?
I think schools, or really any institution that wants to make sure that it is reaching the whole population, not just those that are willing to turn up. I think people often talk about, use the term, and I think it's a terrible term, hard to reach parents.
Yeah.
When in fact, are the schools hard to reach? Are schools inaccessible? Are schools set up in a way, for example, I'm using schools as only an example, I'm sure many institutions, clinics, service providers are in the same situation. What should we be doing and reflecting on our own structures and organisation that is making it a not so pleasant place for people to come? And many schools, and some examples in our research that we've found that have been applied, is engaging with parents off campus. Often parents have bad associations with schools, and so engaging in those environments is not helpful. And in those environments, providing things that are really important to parents: childcare, give me some food, maybe some little incentives to come, cover my costs, all those sorts of things that we know are really important barriers to engaging all families
Yes.
equitably.
And fitting all families. And so that's quite a good segue to you, Sophie. I'm wondering about all the types of support we're talking about, how you modify that, or how can you ensure, let's say, a cultural fit, how can you ensure that it's a good cultural fit?
Mm. Yeah, I think it's a tricky one, because so much of the research is not conducted necessarily with those who you might not get in the door, the hard to reach parents you've just talked about, Donna. And it sort of reminds me of working in the child and adolescent mental health services and training and research and that kind of area that I've been involved in the last nearly 20 years. It's so hard to get people in that setting, parents, to engage in parent work and work where they may use an evidence-based parenting program. And it seems to be this huge resistance the more the problems increase to actually accessing parenting help and support. Well, there can be, depending on the family, depending on the service as well. So we are still talking about a lot of barriers that can be about trust, that can be about feelings of being blamed. They can be about a lack of accessibility. Will I be condemned? Will I get sent through child protection? All these different things are these barriers that we really have to look at. And then that's where we often don't have the research to look at how do we work with those who may have those barriers and how do we evaluate what works with them. And that's a really hard challenge for us.
Daryl, what do you think if we look forward, and we've just touched on COVID and the challenges it presents, what kind of parenting programs or interventions do you think are going to be needed more as we go down the future?
I think clearly the issue of online is a really important one. A lot of service providers, whether you think of schools, early childhood centres, through to, a whole range of other, supports have really struggled. I come from Melbourne. We have lived through a number of lockdowns, and our hearts go out to Sydney and many places in New South Wales where they're experiencing lockdowns at the moment. And so we kind of have to think about how we provide services and how we engage with parents and families in different ways, and clearly online is one of those ways. But I think we also need to be able to think about the timing of when services are provided. If you only provide a structured kind of parenting program 9 to 5, when parents might already be working, that's going to be a challenge. If you don't provide childcare, if it's outside of hours, all those kind of things, I think, are some of the challenges that we're going to need to be grappling with. But also taking things to scale. If in fact we need to have a a workforce that is able to roll this out to, the millions of families that we have in Australia, that means a lot more people need to be equipped. And of course, that advice that we want around parenting is often more welcomed from those who we already trust, which, as Donna said, is a challenge for, schools. They've already got a lot on their plates, and yet they are one of those groups that we know already have high levels of trust from the community.
So many good points you raised there. Matt, how do you scale evidence-based parenting in the way Darryl's outlined?
Well, to start off with, I would say you don't work on an assumption that a single randomised trial is a sufficient basis for scaling an evidence-based program, because one of the things that is going to be very obvious very soon is that soon as you start claiming an evidence for something, that it's likely the question will come up, have those findings been replicated? Have they been independently verified? How do the effect sizes on various outcomes compare to existing available programs? But more importantly, you've got to have programs that are scalable, and they're ready to be scaled in the community. I mean, we found in our work at the Parenting Family Support Centre that as a university, we found it really difficult to scale our evidence-based parenting programs, and we needed to have the support of an industry partner, which was Triple P International, who became an expert at doing this, and they've scaled it globally. But it has to be done in an economically sustainable way, because remember, an evidence-based program is capturing the effects at a single point in time. If we think it's all done and dusted because we've done a couple of trials, we constantly have to remind ourselves that you have to reinvest in ongoing research and development, allow programs to evolve, to improve, to become more culturally attuned to very diverse contexts. But basically, you have to have a system of dissemination and professional training, of implementation science that's based on quality delivery of evidence-based practices, and with sustainment of those programs in mind over time.
So we need that investment, but we also need obviously to work together. And Sophie, I might come to you first here, and put you on the spot on how we might work together to actually create the change all of you are talking about, this thriving future for families. So Sophie, how do we bring together diverse perspectives, or how do we reduce the stigma and barriers to allow as many parents as possible to actually access the programs that you're all talking about?
Wow, that's a huge one. We as a group of Parenting Family Research Alliance group, we have tried to do that, as I was saying, across many diverse approaches, because we recognise that when we work together, we have a stronger voice. Yes. So it's really interesting moving from that phase of sort of being researchers and disseminating interventions to then going, okay, that's not enough. And as Matt was just saying, it is about talking into government, educating people in government about why these evidence-based parenting supports and practices are important for a range of child outcomes. So we do have to do that education piece. How we work together better? Well, we are probably at a time, and it is with the technology as it is. We are all sitting here in a meeting, from all over Australia, potentially all around the world, and we can do that better now in the last year than I think we ever have before. And maybe this is an important time for better cohesion, to have a clearer voice. And then, we still need a kind of a clearer voice around, I think, how can you offer parenting interventions at all those levels, from light touches right through to much more intensive interventions? And how can we get that reach? And to do that, I think we have to have a bit more of a cohesive plan.
Great comments there. What about the design of the programs, though? Who are the stakeholders that need to be included? Because we talked a little bit earlier about the role of a child's voice, for example.
Sure, right. Yeah, well, I think it's going to communities, to children, to families, to communities, about what they believe their needs are, what they want. And also that whatever is offered by their communities, people within their communities. I mean, I hate the idea of experts coming in and sort of attaching to me and giving me things. I don't think anyone likes that. But when it becomes part of the culture that you're in and part of the community that you're in, that is going to be more accessible. So yes.
Okay, so when you, what Matt just said and what you said, and I'll go to you, Jarrell, to answer this. I mean, you wonder why these programs haven't been better integrated into public health and social welfare programs. They're evidence-based, they're available, they're accessible, they engage parents from little right through to end of life. What do you think is stopping that integration, Jarrell?
Well, even though we mouth that we have a public health approach to many things like parenting support and my area of interest in child maltreatment prevention, the reality is we haven't actually brought everybody to the table who can really play a part in that. So we've had a national framework for protecting Australia's children for the past 12 years, and that's really been governed and driven largely by children's ministers. So the ministers that run the statutory child protection services. We haven't really had strong engagement with the ministers who are responsible for education and early childhood sectors and health. So we haven't, in my view, really genuinely engaged with a public health approach, because that would mean that, you know, people who are responsible for school systems were actually not just part of the conversation, but were really driving it, that they saw the infrastructure that they have of the buildings and the kind of social capital that they have of those positive relationships with parents really driving access to those wonderful evidence-based programs and supports.